Have you noticed that walking feels less steady than it used to? Maybe you stand up and feel a little off balance. Maybe your steps feel slower, heavier, or less secure. Maybe you have caught yourself reaching for the wall, the countertop, or the back of a chair more often than before. If you are over 60, it is easy to assume this is just part of aging. But sometimes the real reason is not just age. It is not just weak legs. It is not just getting older. Sometimes the cause may be sitting right inside your medicine cabinet. And that is what makes this topic so important. Because certain medications can affect your balance, your coordination, your blood pressure, your alertness, and even the way you walk. In some cases, they can quietly raise your risk of dizziness, stumbling, and falling without you realizing that the medicine may be part of the problem. Now, let me be clear right from the start. This does not mean your medication is bad. It does not mean you should stop taking anything on your own. And it does not mean every walking problem comes from medicine. But if you are over 60 and you have noticed changes in your balance or the way you move, your medication list deserves a closer look. In this video, we are going to talk about 7 common types of medications that may affect balance and walking in older adults, why they do it, what warning signs to watch for, and what to do safely if you think one of them may be affecting you. Because protecting your balance is not just about preventing falls. It is about protecting your confidence, your independence, and your ability to keep moving through life safely. Let's start with one of the most common categories of all. 1. Blood pressure medications. Blood pressure medications help millions of older adults. They can protect the heart, reduce stroke risk, and support long-term health. But in some people, especially after 60, they can also contribute to dizziness or unsteadiness. Why? Because these medications are designed to lower blood pressure. And if blood pressure drops too much, especially when you stand up, your brain may not get the steady blood flow it needs for a few seconds. That is when you may feel lightheaded, weak, unsteady, or like you need to pause before taking your next step. Some people notice this most in the morning. Others feel it after getting out of bed, standing up from a chair, or walking after sitting for a long time. You may even say things like, "I have to stand still for a second," or "I feel a little wobbly the first few steps." That matters because if your blood pressure medicine is lowering pressure just a little too much at the wrong moment, it can affect your balance even if the medication is otherwise helping you. This does not mean you should stop taking it. It means you should pay attention. If you feel dizzy when standing, if your vision briefly dims, or if you feel like your legs are not stable right after getting up, bring that up with your doctor. A small dose adjustment, timing change, or medication review may make a real difference. 2. Sleeping pills and sedatives. Now let's move to another major category, sleeping pills and sedatives. This group is especially important because it can affect much more than sleep. These medications may make you drowsy, slow your reaction time, reduce alertness, and make your movements less coordinated. That can have a direct effect on balance and walking, especially during the night or early morning. And for older adults, the effects may last longer than expected. You may take something to help you sleep at night, but still feel groggy, heavy, or mentally slow the next morning. That carryover effect can make your walking less steady even after you are fully awake. This is one reason falls often happen during nighttime bathroom trips or first thing in the morning. You get out of bed. Your body is still sleepy. Your reaction time is slower. Your balance is not as sharp. And suddenly, something as simple as walking across the room becomes more dangerous than it should be. Some people do not describe this as dizziness. They simply say, "I feel off. I feel slower. My legs do not feel quite right in the morning." Those small changes matter because the combination of drowsiness, slower reflexes, and weaker balance can greatly increase the chance of a stumble or fall. If you are taking any sleep aid and you notice grogginess, poor balance, or unsteady walking the next day, it is worth discussing with your doctor or pharmacist. 3. Anti-anxiety medications. The third group is anti-anxiety medications. These medicines can be helpful for calming the nervous system, reducing panic, or helping someone feel more relaxed. But that calming effect can also come with a downside, especially in older adults. Some anti-anxiety medications may make you feel drowsy, slower, less alert, or slightly disconnected from your normal body awareness. And when your body awareness is reduced, your balance can suffer. Walking is not automatic in the way many people think. Your brain, eyes, inner ears, nerves, muscles, and joints all work together to keep you upright and moving smoothly. If a medication dulls that system even a little, your steps may become less precise, turning may feel less stable, getting up quickly may feel harder, and your risk of losing balance may go up. What makes this tricky is that the change may happen gradually. You may not suddenly think, this medication is affecting my walking. Instead, you may slowly begin to notice more hesitation, more caution, more hand support, or a strange floating feeling when you move. That is why these medications deserve careful attention after 60, especially if you take them regularly, at higher doses, or alongside sleep medications or pain medications. 4. Strong pain medications. Now let's talk about strong pain medications, especially those that act on the brain and nervous system. These medicines may be prescribed after surgery, injury, or for chronic pain. They can be helpful and sometimes necessary, but they may also affect alertness, coordination, and walking in ways that older adults do not always expect. Some strong pain medications may cause drowsiness, lightheadedness, slower thinking, poor coordination, or delayed reaction time. That combination can make walking much less safe. And here is the problem. Many people think the unsteadiness is coming from pain alone or from age alone, when in reality the medication may be adding to it. If your brain is moving slower, your feet may not respond as quickly. If your attention is reduced, you may not catch yourself in time. If your coordination is off, even a small obstacle can become a big hazard. This is especially important if you are already dealing with weakness, poor vision, neuropathy, or previous balance issues. Because the medication may not create the whole problem by itself, but it may tip the balance in the wrong direction. If you notice more walking difficulty, more sleepiness, or more instability after starting a strong pain medication or changing the dose, that is something to report. 5. Diuretics, also called water pills. Next up, diuretics, also known as water pills. These medications are commonly used to reduce swelling, manage blood pressure, or help the heart and kidneys. They can be very important, but because they help the body remove extra fluid, they may also lead to dehydration or lower blood volume if the balance is not quite right. And that can directly affect balance. If your body is low on fluid, blood pressure may drop more easily. You may feel weaker. Your muscles may feel less steady. You may become lightheaded when standing, and walking may feel more difficult than usual. This can be even more noticeable if you are also sweating more, drinking too little water, or taking other medications that lower blood pressure. Some warning signs may include dry mouth, fatigue, muscle cramps, dizziness when standing, or feeling shaky and unsteady for no obvious reason. For older adults, even mild dehydration can increase fall risk. That is why water pills should be respected and monitored carefully. They may be helping one condition while quietly making balance harder if fluid levels get too low. Again, the answer is not to stop the medication on your own. It is to recognize the pattern and speak with a healthcare professional. 6. Certain antidepressants. The sixth category is certain antidepressants. Not everyone who takes them will have balance problems, but in some older adults they can contribute to dizziness, drowsiness, slower reflexes, or changes in walking. This is especially important when first starting the medication, when the dose is increased, or when the medication is combined with other drugs that affect the brain or blood pressure. Some people describe the feeling as being a little foggy, a little heavy, a little disconnected, or slightly unsteady when moving around. Others notice they are more cautious when turning, slower when walking, or more likely to feel off balance when standing up after sitting. And because depression itself can affect energy and movement, it may be hard to tell what is coming from the condition and what is coming from the medication. That is why changes should be monitored carefully. Any new unsteadiness, new dizziness, or changes in gait after starting or adjusting an antidepressant should be taken seriously, not with panic, but with attention, because in older adults, even a subtle change in stability can matter. 7. Diabetes medications that can lower blood sugar. The seventh category is diabetes medication, especially medications that can lower blood sugar too much. This is very important because low blood sugar can affect the brain, muscles, and balance very quickly. If blood sugar drops too low, you may feel weak, shaky, sweaty, confused, dizzy, or unsteady on your feet, and that can be dangerous. Some older adults mistake this for simple fatigue or think they are just having an off moment. But if blood sugar is dropping too low, walking can become much less safe very quickly. You may feel your legs turn weak. You may feel your head go light. You may lose focus, and your risk of stumbling can rise fast. This is especially important if meals are delayed, appetite is poor, activity levels change, or medication timing is not well matched to food intake. For older adults with diabetes, noticing a pattern matters. If you often feel shaky, weak, or unstable before meals or after taking medication, that is something that should be reviewed, because good blood sugar control should help protect health, not leave you feeling unsafe when you walk. The bigger picture now, after hearing all 7 of these categories, you may be thinking something important. What if I take more than one of them? That is exactly the right question, because for many older adults, the issue is not one medication alone. It is the combination: a blood pressure pill, a sleep aid, a pain medication, a water pill, something for anxiety or depression. Taken together, these may affect balance much more than any one medication by itself. That is why a medication review can be so valuable after 60. Not because medicine is the enemy, but because the body changes with age. The liver and kidneys may process drugs differently. Sensitivity may increase. Side effects may last longer. And the same dose that once felt fine may begin to affect balance and walking more than it used to. What you should do safely. So what should you do if you think medication may be affecting your balance? First, do not stop any medication on your own unless a doctor tells you to. That is very important. Second, start paying attention to patterns. Ask yourself, do I feel unsteady after taking a certain pill? Do I feel worse in the morning? Do I get dizzy when standing up? Do I walk differently after taking medicine for sleep, pain, or blood pressure? Third, bring a full medication list to your doctor or pharmacist. That includes prescriptions, over-the-counter medications, vitamins and supplements. Even supplements can matter. Fourth, describe the symptom clearly. Do not just say, I do not feel right. Say, I feel dizzy when I stand. My walking feels less steady. I feel groggy in the morning. I have almost fallen twice this month. The first few steps feels weak. That kind of detail helps professionals identify patterns faster. And finally, protect yourself while you sort it out. Stand up slowly. Use support if needed. Keep floors clear. Make sure lighting is good. And do not ignore near falls just because you did not hit the ground. A. Near fall is still a warning. When to seek medical help quickly. There are also times when you should seek medical help more urgently. If balance problems or walking changes come with fainting, chest pain, shortness of breath, new confusion, slurred speech, sudden weakness or repeated falls that needs prompt medical attention, those symptoms may point to something more serious than a medication side effect. So here is the bottom line. If you are over 60 and your balance or walking has changed, do not assume it is only because of age. Sometimes medication may be part of the reason. Blood pressure medications, sleeping pills, anti-anxiety medications, strong pain medications, water pills, certain antidepressants, and diabetes. Medications that can lower blood sugar. These are all common, and in the right situation, any one of them may make walking less steady or balance less reliable. The good news is that once you recognize the possibility, you can do something about it, not by stopping medication on your own, but by paying attention, asking questions, and working with your doctor or pharmacist to make sure your treatment is helping you without making you less safe. Because this is not just about medication. It is about keeping your balance, protecting your mobility, preventing falls, and staying independent for as long as possible. Before you go, I would love to hear from you. Have you ever noticed that a medication made you feel dizzy, weak, or less steady when walking? Leave a comment below and share your experience. And if you found this video helpful, subscribe for more simple, practical senior health tips to help you stay strong, steady, and safe after 60. Take care of yourself, stay aware, and I will see you in the next video.